Okay? On this, the reason why I have them starting face up is most people are tight in their hip flexors and tight in their chest. Okay? It's actually easier to start them off facing down, okay, because it's easier to do the rocking motion that we're about to do. But for this case, we're going to start face up. Okay, we'll start in this way, and we're going to go through the process. So we're going to start at the legs, and what we're looking for on this movement, start here at the quad, is we're looking for just creating a rocking motion. So this is like that rhythmic compression that we were talking about. Okay? And all I'm doing is I'm compressing into the quad, and I'm letting the leg rotate. Okay? And if you notice, it's not just his leg that's rotating, but you can also see how the rest of his body's responding. Okay? Now remember, the slower you go, like if I go slower like that, that would be more for post-event. Okay? If I go more vigorous and shorter vibrations, that's going to be more for pre-event. Okay? And I would spend less time. If it was post-event, I would spend more time. I wouldn't go as hard, and it'd be more gradual. Okay, so remember that. So basically, this is what we're teaching to you. If you go slower and more gradual, then that's going to be more for post-event. If you go faster and quicker, that's going to be more for pre-event. Okay? So keep that in mind. So you're just working down the leg. You can work down the leg and then work back up the leg. It doesn't matter how you do it. And then go onto the side of the hip. Just doing some compression on the side of the hip there.
Doesn't matter by the way.
Good. Okay. And notice I got my hand still on his leg, so it's still creating some rotation there in the leg. Okay. And then I have a choice. I can either go to the other leg or I can move up to the shoulder. Okay. So for the shoulder, just a compression right there on the shoulder, and it all depends on what they're doing, what event they're doing. If they're doing an event where it's going to be a lot of upper body involvement, okay, and you'll do some gentle stretching like this, where you're compressing and stretching the arm, okay, doing external rotation, and then also extension, okay. And then we can do the same thing. We can just kind of work the arm all the way down, just doing some compression on the bicep. Again, you can go, if I'm going down, it's like I'm kind of creating a stretch. If I go up, and that's kind of helping with circulation, okay? So you can go in any direction, it depends on what your intent is. That's the important part, right? Then we'll go to the other side, do the same thing on the other side. And on this, you can be specific to muscles if you want to be, okay? You don't have to be general. Like if I felt that his IT band was a little tighter, and I could switch my position, I just kind of do some compression on the IT band and on the vastus lateralis, okay? And maybe slow it down just a little bit as I'm doing the compression, right? And then go back to the rocking again. And what JP will feel is that his hips will feel looser. He'll feel like he's not in control of what's going on with his body, because it's that jostling that's happening, that rocking motion where he has to let go of what he's doing, okay? Remember, none of this is specific towards, we're not correcting anything. This is just a pre-event. Okay, or if we go slower, it's a post-event.
But this could be used to a correction also.
It could, yeah. I mean, you know, it's like I said, it's not specific. So like if I was trying to correct his pelvis, I could do that as a pre-thing to warm him up before I started doing any kind of corrections on his pelvis, before I started doing any muscle tissue loosening or anything like that. Okay? Or if I was going to work his shoulders, like you need a shoulder work, I could work this one, like, yeah, this side feels a little tighter. Let's start on this side, okay? And if I was doing that pre-event, if I was doing an inner event, any of those things. So this can be an assessment tool, right? Or it could just be something real general, loosening for them. Okay? So loosening up the pec through there. Okay, creating a stretch. Remember, if you needed to spend more time on any of these areas, you could. Okay?
You can really feel it was tight there in the shoulder.
Yeah, it was.
Yeah.
I feel like, can you?
Yeah.
So
And you concentrate on the IT band, which is also a quick assessment target.
Yeah.
Yeah.
So it's like you feel tightness in one area, then go to that area and work that a little bit more. Okay, people just don't want to put their face down on the face rest.
Right.
It's all dependent. But here's the thing: when we start working the back, head positioning is important. If they have a neck issue, then definitely having a face rest is really helpful. Okay. So when you're working on them, I'm going to work on the opposite side of the back. So instead of working on this side, I'm going to work on his right side. He's going to turn his head and face me. Right? Just like that. Yeah, you're good. And what you're going to do is the same thing. Just a rocking motion. It's like you're hooking into the erector and pushing the erector, pushing the body away from you. Okay? As you're doing this, notice that it's getting the hip. You can also put one hand on the sacrum and rock the sacrum as you're working up the erector.
Same direction or opposite direction?
It can go either way. Oh, you mean the rocking in the sacrum?
Uh-huh.
It's going the same way. Yeah, if I go opposite, watch what happens. Like no movement. Okay? So the intent of this is to rock the body, which then helps them to let go. Okay? Especially after an event. That's important. Okay? Before an event, this could be helpful. You just wouldn't want to loosen them up to the point where they're loosey-goosey and not able to move and feel so relaxed they don't want to go race. Okay? So again, your duration might be shorter. Okay? You might be quicker on the movements like that for pre-event. Okay? Make them real quick. If you felt something tight, address it and then move on. Okay? Or just loosen them up.
So somebody who, has done a lot of squats in one of those events, what is it, CrossFit?
Yeah.
This is what you would do, like, before
yeah, this is one of the things I would do, yeah. Okay? So, working the glutes, okay, compressing. Notice that I'm compressing down and away from his low back. I'm not compressing up into his low back. The reason for that is I want to decompress his low back. Okay? So all my compressions in the glute area are going to be away from his low back down towards his feet to get that to loosen up. And we can even take the leg and just do a little bit of rotation with it. Okay? If we felt some tightness, we could spend more time in that area. Okay? After we're through with the glute, we'll move down to the hamstring. Do the same thing. That rocking motion that we're looking for. And notice that we're getting the whole hip going. Working all the way down. Notice that I don't have a bolster. His feet are hanging off the table. Okay? If you're at an event, you don't have a bolster, you just didn't bring one with you or whatever. Remember that you can still use a roll-up towel, or you can have them hang their feet off the table. Okay, then move around to the other side and do the same thing on the other side. Notice he turned his head. So I can do both hands up the erectors. It seems a little bit tighter on this side. So
Mine is even tighter than it is.
does this side feel tighter?
Yeah.
Okay.
I think it's because I know why.
So get to practice later on.
Arms, big press.
Okay. So just working right up the erectors like that. Remember, you can go down to the sacrum and do rocking of the sacrum as you're working up the erector.
Really big press.
can even take one hand and push down while you're rocking. So it's like I'm deep pushing down on the sacrum as I'm rocking the erectors, which will also decompress as well. You kind of put yourself in a bad position, but you know, if you just do that a few times, it's not that bad to put yourself in that bad of a position. Okay? Then work the hip, same thing. Okay, you can just do compressions like that. And remember that pre-event is vigorous and superficial, okay? And post-event is gradual and slow. So just remember that. And then going down the hamstring, like we did before, I can even take the knee and bend it and do this and do more vibration on the hamstring like that to get it woken up. And you'll find that when we get into the rest of the course that there's a reason why I'm starting to face up, because typically most people are tight in their hip flexors and their hamstring problems. Sometimes it is because they're tight, but other times it's because their hip flexors are so tight it's pulling the pelvis into flexion or an anterior tilt, and it's causing the hamstrings to be tight. Okay? Right, and we're working right down here. Same thing.